Well, my goal for people that come here is to be really comfortable. For one, you can pull up and park, and that's nice to be able to walk in somewhere. And when you walk in, we've got great staff that's really friendly. Everybody goes out of their way to make sure that everybody's comfortable and that you have something to drink, and it's decorated in a way that it's somewhere you would want to come, somewhere you would want to be. I'm real happy with my staff now, and that's because I don't have to stay on them. They'll make, if we have a patient come in that, has had a rough day or is talking about something that happened at work, I'll turn around there making her a goodie bag full of skincare samples, and without me telling them. And that happened today, and that's the kind of thing you just can't find. It's hard to find people that are just really genuinely good, and they're not afraid of me. I'm not going to yell and scream at them, and so they have to just genuinely be able and want to do the right thing without being afraid. My father's a surgeon, general surgeon. My sister's a gastroenterologist. I wasn't going to go into medicine. I had no intention of going into medicine. I wanted to be in theater. I wanted to be on soap operas. And as I went to college and started out with a theater major and just really realized I wasn't doing anything for anybody but myself, and I really wanted to give and to do something for other people. And I started taking biology, and I've always loved animals, and I loved it. I just love learning the way things work, and it was fun. It was more fun than anything else I was taking. So from there, I just developed a desire to go to medical school. And when I applied, I had no idea that, I would end up doing this. My dad always said, don't be a surgeon, it's too hard. I don't want this kind of life for you. And so my goal was to find something else that I liked. I'm board certified in otolaryngology, which represents the head and neck specialty. So, and then I did a year of fellowship in cosmetic surgery, which is strictly aesthetic surgery of the face, nose, breast, and body. And I'm a fellow in the American Academy of Cosmetic Surgery, a member of the American Academy of Facial Plastic Surgery. Really, everybody that comes through makes me feel good, whether it's Botox or just somebody getting a facial that comes in and says, my makeup looks so much better, I feel so much better about myself.
What she's done has gave me a real big boost of confidence that I was losing fast.
It's amazing. Dr. Petro she has a gift.
Some of the bigger things are the surgeries, obviously, because it's a bigger change. And, I have a girl who's a nurse, and she's, in her 20s and has never worn her hair up before. And I saw her just last week, and her ears are pinned back now, and they're smaller, and she's less self-conscious, and she came in with her hair in a ponytail, and she'd never worn her hair up her whole life. So those kind of things really make you feel good. Or, we see people come in and they're kind of shy in the way they dress and the way they hold themselves, the way they walk, and after their surgeries, whether it's a facelift or eyelids or whatever it is, they come in and they walk different, they dress in brighter colors. It's like they just blossom, and you can just see their happiness all over their faces.
Every day that I would get up, I felt like I had to have heavy makeup on to cover a lot of flaws, from age spots to droopy skin and everything. And now I feel like if I'm late for work, and that's always, I can get up and just put on a little bit of mascara and go, and I'm happy with the way I look.
So knowing that you can affect somebody's life that way, and love doing it, really love doing it, it's an amazing way to live. It's amazing that, sometimes I just can't believe that this is a job, that people actually pay me to do this stuff, because truthfully, I'd probably pay them to let me do it.
I think she's beautiful, so she does a lot of inspiring herself. She's beautiful, and her personality matches.
I am very honest with people, and most of my patients that are recurring patients, that's what they appreciate, is the honesty. There's not really any other way I could be, because that's just one of my things. I think people should tell the truth.
She is a woman. She knows how it feels to have an area of your body that you would like to have different.
She understands a lot more.
I don't think it's right for people to come in and say, oh, you look great, or you look so good in your clothes, you have no idea what I'm going through. And I'll always stop them and say, I've had lipo, I've had my breast done, I've had a run up my nose, I've got cheek implants, my ears have been pinned. There's nothing that just happened. And I think that's important for people because, I mean, just like we were talking about earlier with the celebrities where they come out with all these great machines for your abs or your thighs or whatever it is, and then you find out they've had all this stuff done, and you're like, I would have felt so much better if I had just known that.
We can exercise, we can diet, but as you age, gravity does pull down your skin on your face. But we don't want to look unnatural. We want to be beautiful and lively, and she understands that. She knows how it feels to be a woman.
I had had some things done with a male doctor and had no complaints at all. Well, until I saw Melanie's work, and then I really believe that Melanie knows what women want.
I can very easily talk to people about what it's like from both, and I tell them, I'm talking to you as a patient now. I'm not talking to you as a doctor. I mean, this is how it feels. This is what liposuction feels like. This is what you can expect. And, you know, it's good to hear it from somebody how it feels, but I think the most important thing is people not putting on this facade of, I look so great because I exercise and, I mean, eat right. I mean, that's just stupid, for lack of a better word. I mean, it's just nice for people to be able to hear, you know, how it really is and the way things are.
Like I had told one of her nurses, I said, I don't know who I am to be this little Alabama girl, you know, to have such a beautiful turnout when I've seen stars that I didn't think looked as good as what she's done.
I'm just glad that I went ahead and stepped out and did it, and I wouldn't take anything for it.
I am very happy, very happy.